Story 1. Dude, I have to administer naloxone to people in a park. I'd much rather do it in a clinical setting where they know I'm gonna do it, so they're less likely to try and punch my lights out for ruining their high. Story 2. Public health worker here. What everyone is missing is that it is a harm reduction method. No, it's not ideal, but it's gonna happen whether or not we like it. So, it's better that they do it in a safer, sterile environment. I recommend you all to read High Price by Carl Hart. A lot of you have strong misconceptions about addiction and the role that social aspects like community play in addiction. Also, welcome to public health. There is no perfect intervention that will solve all problems. People are too complex for that. Story 3. In keeping with the original question, I personally would not want to have the job. It would fundamentally alter the way I currently practice, and this far into my career, I don't think it would be safe for me to perform this particular job. I do see the value in the service, but it will take a very specific person to do the job. You want someone who not only knows how to monitor and reverse the narcotics as needed, but also knows the difference between someone just being really high or actually dying. If the staff just goes around reversing all the intoxication, then nobody will use the space at all. Story 4. I'm a medic in Philadelphia. Drive down a mile-long stretch of Kensington Avenue, and you will see at least one person actively injecting with a needle in their arm. Something needs to be done. I don't know if this is the solution, but we need to do something. I'd rather have this done and fail than not do anything at all and continue watching my city succumb to this epidemic. Story 5. I have a question about this question. Is it accurate to say to legally use drugs? I always thought it was still plenty illegal, but in kind of a no enforcement zone so that users wouldn't have an extremely obvious reason to stay away. Story 6. I am a registered nurse, and I would work at this type of job if the pay was comparable to similar jobs. I believe these people need help. They will be using no matter what. At least there is less chance they will die at a place like this, and I would imagine the facility would provide resources to people who are ready to get clean. Story 7. They are a good idea in hindsight, but in saying that, I have seen what happens around the surrounding areas. A massive downside to them is that there are not enough rooms in the one in my area, which causes one major issue that leads to other issues. The issue being that people go there and have trouble waiting to have their session, so they are having it in the parking lot and surrounding areas, which is in plain sight of other businesses and schoolchildren in the area. There are drug dealers who prey on these individuals with the knowledge that they will be impatient and are selling drugs to them in plain sight, which once again is right in plain sight of the mentioned areas. As a result, it is painting parts of the area in a bad light and is slowly impacting businesses that have become fed up. People are coming from all parts of the state to the safe injecting room, and there simply is not a big enough facility to deal with the number of people that come. Story 8. The ones in Vancouver may have medical professionals available, but the people who work at them are much more likely to be just employees. It is a unionized job here. Many people have a background or education in social work, but not medical degrees. I know a lot of people who work in these services who are musician friends. They like it because they can take time off to tour whenever they want. They are not easily frightened by how crazy it is, have very leftist politics, and like helping people. Detox is literally in the same building on a different floor than the one in Vancouver, and the people who work in these places tend to go to different buildings that are administered by the same or linked organizations. So, the people working for the safe injection site would also be working at single-room occupancy places or other mental health services and homes around the rest of the city. There are a lot of issues with corruption among the people in charge of these organizations, in my city anyway. Many of the workers end up having to take leaves of absence or go on workers' compensation for post-traumatic stress disorder, due to the amount of severely disturbing situations they deal with all the time and not being given proper support by the people in charge, who often cut costs by not following safety procedures and abiding by the rules of their own union. It's an extremely difficult job with huge burnout rates. For a better idea of what it looks like here, and to evolve some people's black and white opinions regarding addiction, I highly recommend books by a doctor who works in Vancouver's downtown east side, Gabor Mate. Story 9. Throwaway here so hopefully nobody identifies me. I don't see a lot of medical professionals in this thread. So here is the perspective of a registered nurse who has cared for overdose patients and patients with a history of intravenous drug abuse or addiction. I could never work in a setting like this, and I feel that most of my colleagues would agree. 3 major reasons come to mind. 1. Ethical and health concerns. I cannot ethically condone drug use under my watch, just to give them naloxone and let them continue to use. Those drugs are harming the person. Giving them a safe space to use by eliminating the risk of overdose does not reduce all risk or harm of using the drug. Intravenous drug users are at major risk of infective endocarditis. This is when bacteria enters the bloodstream. Repeat venipunctures push bacteria on the surface of the skin into the blood vessels. This bacteria attacks the heart valves, causing major damage to the heart and requiring open heart surgery to replace the valves. If left untreated, it will lead to heart failure and a painful death. Even when treated, life expectancy is drastically reduced. Legal concerns. What if, despite my best efforts, the patient overdoses and is unable to be resuscitated? Am I liable for malpractice? What if the person develops one of the many other complications from intravenous drug use? Am I liable for those because I was a trained medical professional available to them when they were using? A good malpractice lawyer would have a field day with this not worth losing my hard-earned license or career over. Safety concerns. Illicit drug use and intravenous drug users can sometimes be desperate when looking for their next fix. I have been threatened in my current practice setting for not bringing pain medication fast enough or not giving higher doses than prescribed. I have colleagues who have been assaulted for similar issues. What if I am threatened, cornered, or robbed on the job or outside? Will there be enough security to handle this? I'm not judging a book by its cover. I care for patients with intravenous drug use and their complications on a regular basis, and I don't treat them differently than anyone else. But these are valid concerns that any healthcare professional would have working in this setting. Edit. For those refuting my points without any evidence, please give me some studies to read. I'm a nurse. Nurses love evidence-based practice. Story 10. Not a medical professional, but we have one of those here in Calgary, and they were trying to open up a couple more, including by my house. They do prevent overdoses, but also greatly cause a rise of crime in the surrounding area. I didn't want one near my house, nor would any sane person. Don't get me wrong, I feel horrible for opioid addicts. I carry naloxone daily, but I feel like there needs to be a better strategy for helping them than spending millions of dollars to give them a safer place to overdose. Story 11. Medical professional here. I couldn't do this job. I understand the argument, and I'm not completely against it, but for me, it wouldn't align with my personal understanding of do no harm. While I'm not administering the drugs, it feels too much like I'm enabling them. Sitting by and allowing people to do drugs nearby that could potentially kill them doesn't sit well with me. I'm all for making drug-related interventions, therapy, rehabilitation, and more available, but this doesn't feel right. Edit. I am trying to say I wouldn't work there. I am not trying to say others can't. Story 12. I help John by giving him a clean needle and inspecting his dosage, then give him the go-ahead to inject. He overdoses and resuscitation fails, resulting in death. Weeks later, Johnny's family is suing me or others for medical malpractice. This just adds to the never-ending rise in malpractice insurance. Story 13. Emergency medical technician and Medicare. Let me just say this. Know what you're buying. I don't care if you're getting drugs illegally or what, but I am so sick and tired of people buying drugs laced with fentanyl, and they just flatline. Story 14. The United Kingdom has had places like this for a while. In Brighton, they're colloquially known as shooting galleries for obvious reasons. It's a great idea that not only reduces the risk of overdose, but also can act as a base to do needle exchanges, which reduces HIV and hepatitis transmission, and also saves money from dealing with liver cirrhosis and antiretroviral drugs, and weaning routines onto methadone, which reduces the number of addicts. Even if you're not into helping drug users from a humanitarian perspective, it makes financial sense. Story 15. As someone who works at a methadone clinic, I think this is a horrible idea. The current methadone clinics are ineffective. Why give another way for addicts to use drugs when the current options rarely lead to recovery? Story 16. I am not a medical professional, but this sounds like a horrible idea. What if someone has a violent reaction from a powerful narcotic and ends up killing someone because the emergency medical technicians do not get to them in time? This just sounds like an accident waiting to happen. Story 17. The city I used to live in is facing challenges because no one wants the facility close to anything else. People understand the concept of it being helpful, but it's a whole other issue when suddenly there are drug users flocking to the area where you live or where your business is. As someone who has worked in addictions and mental health, in all honesty, you could not pay me enough money to work at a facility like this. There is no salary that I feel properly compensates people for the amount of craziness you'd experience working in a place like this. I truly believe these facilities are important, useful, and needed. However, I could not work in one. Props to anyone who does. You're underappreciated and probably underpaid for the amount of stress you're under. Story 18. Not a medical professional, but they did this in my city, and it has worked great. I did not support it at first, then became hesitant because it sounds counterproductive. If you want to make drug use go away, giving them a place to use drugs sounds like the exact opposite of the right idea, and it will encourage drug use rather than help clean up the city. But I was happily proven wrong after seeing how dramatically it's cleaned up my city. I fully support the program now for several reasons. There aren't nearly as many people out of their minds on heroin, passed out in the streets, or wandering and stumbling around like zombies, barely able to speak, much less walk, anymore. Overdoses in general are down, and deaths due to overdoses are down dramatically. There are far fewer needles everywhere because of the needle exchange, where they will give them a clean needle to use every time and provide a place to dispose of their previous needle in a biohazard-safe disposal box, like in hospitals or clinics. Before, you couldn't go anywhere. A park, a mall stairwell, a McDonald's, even elementary school playgrounds and properties without finding needles. You could go nowhere without seeing at least 5 needles in your travels to or from that location or the location itself, most of which had no caps, and you could see blood in and on the syringe. I started wearing steel-toed boots with a metal slab covering the whole bottom of my foot between the rubber and interior from heel to toe because there were needles in the gutters on the road, in every public bathroom, and in aisles of libraries that had a bit of cover. Even some grocery stores had them. It was awful. So many people were getting stuck with the needles too because no one was throwing them away before or even putting the caps back on. I know 5 people personally who have been stuck with one. One was diagnosed with HIV. He knows for a fact he didn't have before from someone who hid an uncovered dirty needle on the bottom of a hand railing in a parking garage. 2 got hepatitis C. 1 from stepping on a needle and it going straight through his shoe into his foot, which is why I started wearing the boots. Thankfully, the other 2 didn't catch anything, but so many others did before the program targeted that issue. One of the worst cases I heard of was when someone actually glued an uncovered needle to the bottom of a children's slide with the needle pointing up, so when a poor little girl slid down, she got a needle jammed in the back of her thigh. Also, because they are getting clean needles for free with 0 questions as often as they want, I have heard that diseases are spreading much slower than before. Arrests are also down because they are being contained to the safe injection sites when high, rather than being on the streets. At the end of the day, it has done wonders for the city, and many other cities too. At first, I was a skeptic, but I'll say once again, I was happily proven wrong. It has improved the safety of the city and public, the lives and safety of the addicts, and I now support this 100%. I recommend you do too. Story 19. I feel like the job would be terrible. Drug users are usually aggressive and unpleasant people. I mean, work is work, and if the pay is right, I'm sure they could find a lot of employees, but dealing with drug addicts day in and day out would become very stressful. Story 20. Why is this considered but not free rehabilitation? Why should the taxpayers pay to help destroy their lives? We are focusing on helping people in the wrong way here. Story 21. Let people take all the drugs they want. However, don't expect society to clean up after their mess. At some point, the training wheels need to come off and nature needs to take its course. Story 22. How does catering to someone's addiction help them? Though it's good to be in a safe place, it's not good to support a detrimental activity. This is a horrible idea in many ways,